Well, welcome to Module 5, and we think you're going to really enjoy the information here because we're going to talk about a really interesting way to neutralize emotional charge. And everybody has emotional charges from time to time, yeah. And so we're going to talk about one of the brain's superpowers is your ability to go so deep down and hover right above sleep. And there are a lot of really fascinating things that happen during that period of time, right above sleep. And of course, you do this every evening. You might not hover there, but every evening you go through all of your brainwave frequency ranges. And then every morning you go through them again, going up. Well, in the 1980s, there's this fascinating group of research projects, studies that we found when we were doing research for our Brain Change Therapy book. And we were actually looking into deep states of mind. We came across a long time ago material that Milton Erickson was doing, and he was interested in using deep states, although he never talked about it. So he would often work 3 and 4 hours with a person.
In trance. And wouldn't say much.
And we wondered, we got to thinking, was it what he said or was it the state? And so we really started exploring these deep states, and we discovered historically we could go all the way back to Egyptian times where the priest, I guess they were called,
the sleep temple,
would have people come into a sleep temple. They would lie them down on the altar and they would be altered, so to speak, right? And go into these deep states of mind. And after that experience, they would get up and walk out and things were better.
Yep.
Well, in the 1980s, so researchers began to look at what they called restricted environmental stimulation. Restricted environmental stimulation. Basically, they began to use flotation tanks. So they would put people in a sensory deprivation environment, and people would float in this very pleasant water, and it would be completely black in there. And your brain has a need to have stimulation. When there isn't any, it will make up its own. And then eventually you get to a state where you're just zoned out. And it's pretty fascinating. And I don't know how many people that are taking this course have ever been in a flotation tank, but it's a really cool thing. And now we're seeing across the country in the States, this kind of research is Surfacing, thank you. I was thinking water.
Right.
Resurfacing, and they're finding some amazing things. Well, so this is astounding. So patients that had the experience of going into these flotation tanks dissolved anxiety, depression went away, they lost weight, their immune response raised, arthritis symptoms went away, most everything that they had cleared up. And again, we're looking at what is the curative factor. It seems to be the mental state, and in this case, the parasympathetic system.
And in that deep state, what the brain releases is endocannabinoid or endocannabinoid, which is the brain's own marijuana.
Right, and we're going to talk about that more specifically in just a minute. So, we've talked to you about a number of things that are what we call neuroactivation training for change, and that is when you focus on space, just to review, that's you produce gamma. When you focus on breathing through your heart, you produce alpha. When you relax your tongue, you turn on your parasympathetic system. When you focus in a deep state on compassion, you activate gamma also. And all of those elevated states in frequency seem to be very regenerative. Well, we've given you a picture, actually from one of our neurofeedback systems, and this person was producing incredibly healthy alpha, and you'll see there that there are high peaks on the system, and 10 hertz is considered to be the best alpha a brain can make.
And there it is, it's set for that 10 hertz, and that's where the amplitude increases.
And you'll see up above that the EEG, and you see how lovely those alpha waves are. They have tall peaks and they're rounded, and you can kind of get the sense just looking at this how relaxed this person was. And it turns out in this very nice state of relaxation, many lovely things happen, but one of the things that happens is that you turn on your endocannabinoid system.
Right.
These are all the areas of the endocannabinoid system that where the endocannabinoid system affects your cerebral cortex, hypothalamus, amygdala, hippocampus, basal ganglia, cerebellum, and your brainstem. That's about everything.
Right, it's pretty much the whole brain.
And so, like you said, this is this release of neuropeptide, family of neuropeptides. These are all the things that are affected: your sleep, appetite,
Mood, motor control, your immune function, reproductive functions, pleasure and reward, pain, and memory is all affected by the endocannabinoid system.
We've given you a picture of a gentleman by the name of Jack Schwartz, who was a very advanced meditator. Now, as you look closely at this picture, notice that Jack has his eyes closed. And by the way, he was a very long-term meditator. He actually was, during World War II, in a Nazi concentration camp, and he had a lot of time on his hands. He survived that, but he taught himself how to go into very, very deep states of meditation, and he could do all kinds of things. So you'll notice in the picture, he is lying on a bed of nails. Please don't try this at home. Because you probably would not have a good result unless you really trained your mind. And isn't this fascinating? You can train your mind to such an extent that even an external stress, like a nail, will not pierce your flesh. How does that work? It's very interesting. So we have a picture, a film of Elmer Green, who's considered to be the father of biofeedback, working with Jack.
And in the film, what Jack does is take needle that's used for knitting sails, and takes it on this rather rough, rather dusty table, and rubs it around, and he sticks it through his bicep all the way to the other side. And he brings it back and forth like he's playing a violin, pulls it out, and you see one little hole. And he lets it bleed enough to make sure that any of the bacteria is exited by the system. And then you actually watch the hole begin to close.
Right. And, you would think if somebody put that sort of thing through their bicep, they'd have a lot more blood.
Yes.
But actually, he's controlling the blood flow also with his mind. This is what is possible. And so Elmer Green, you can look this up on YouTube. The film is on YouTube now. Elmer Green asked him, he said, "So how do you do this, Jack?" And he said, "So I think that when I do this to myself, this is not my body, this is a body. This is not me, it's somebody else. And so we would call that an extreme form of dissociation, right?
Yes.
So this is another superpower we really didn't talk about very much, but it is another ability that we have You know, people, of course, who dissociate too much can have a problem with that.
Right.
But sometimes the use of dissociation is very useful.
So before you move that,
Yeah.
I want to talk about, we had people warm their hands, and we talked about the monks meditating in a room that was a little more than 35 degrees temperature up in the Himalayas. You can control your blood system, blood flow. Well, another way of thinking about that is, how many times have any of you become embarrassed?
Mm-hmm.
Somebody says something and it embarrasses you, and then what happens is you flush. Well, that embarrassment causes your blood flow to change. So your face may become flushed, so on and so forth. We think that is something happening to us. The reality is that the unconscious mind changes it. So that's something you can learn to do. You did that with the warming of the hands. The monks did that with drying the sheets. But there's also another example of that. You talked about his controlling blood flow. The dentist that was Erickson's student, Kate, what was her last name?
Thompson.
Kate Thompson. Yeah. So what Kate Thompson learned to do was, first she was scared of Milton Erickson and tried to hide, but what she was able to do was to control the bleeding. And she would do this in demonstrations. So Kate would take a vein and lift it up, put a surgical needle through, and we had a student do this, by the way, through the vein and pull it out. Now you should, if you adequately puncture both sides of the vein, you should bleed on both sides. Kate Thompson had the ability to make it stop on one side and bleed on the other, and stop on that side and bleed on the other side. There's no biological reason that would happen. Kay went around doing demonstrations. We had a woman who had seen Kay Thompson do this on film and wanted to do something in our hypnosis class. And what she had a problem with was whenever she would have surgery, she would have hematomas. They were not life-threatening, and it wasn't like she was going to bleed to death, but she would wind up with these lumps in places where there was surgery and the blood had pooled. She wanted to be able to control unconsciously the flow of blood so that when she got out of surgery, the blood would flow more evenly rather than pool on one side or the other and wind up with these rather painful lumps. So she came to our workshop and we primed her for this, and we had a physician that did this because we can't play with sharp objects. So she lifted up her vein, put a needle through, pulled it out, and our student ended up stopping the blood on one side, bleed on the other side. Then she stopped that side and bled on that side. So she did that and learned to control her blood flow, just like Kay Thompson was able to do. The other thing that she was able to do was then give herself suggestions that in surgery, the blood flow would be even and it wouldn't pool. She wouldn't wind up with these hematomas. Well, Kay also did one other thing, and there's a film of her sometime after that, where she has nasal resection.
Right.
And so she's
Without anesthesia.
without anesthesia.
Oh my gosh.
And they watch her do that and break the bones and reset it.
Right.
And was able to, and she had that because she needed to have that done because there was swelling and the air wasn't getting through both sides. Well, Kay was able to do that. And so the ability to change blood flow, the ability, again, to modulate pain. You can go that too far and not pay attention. You want to pay attention at some point to pain and discomfort so that you don't do things that further hurt yourself. But again, the ability to use alpha and theta activity, to use that as a way to change blood flow, which again, our group did early on in that first module in warming their hands, which all of us do when we are embarrassed. We have the ability to change our physiology. Now, this doesn't happen necessarily overnight, but it does point to having much more ability to live with health and well-being rather than being just dependent. Not the surgery is bad, not dependent on medication. Well, medication is not bad, but we can work more with these ancillary ways of intervening with the body with our own ability to change brain states.
So, Bill, you can talk about the study that was done, and I just mentioned, so Eugene Peniston was in Colorado, and he went and did work with Elmer Green and took some training from him. So you could tell the story about what happened.
So when he was in training, he got this idea of an alpha theta training. Now, he went and worked in a rehab. It was a hospital program for alcoholics and drug addicts. And he did a research project. And one of the things about drug and alcohol programs is that typically there's an 80% relapse rate after months or a year. So if you have a 20% cure rate to getting people off of alcohol or certain other chemicals, drugs, only about 20% are going to stay cured and off of the alcohol or the drugs for a year. So Peniston went to this program, and he was a psychologist there. And here was the way that the program was set up, and which is perfect research. Everybody in the hospital had to be involved in the basic drug and alcohol protocols in terms of behavior, 12-step types of programs. And so he had a control group who was just going through the main programs. The people that he did alpha theta training with they had to be involved in all of the 12-step programs, all the groups, the therapy, and so on and so forth. And he got alpha theta training.
And you might describe what that was.
So alpha theta training was neurofeedback, which again, they were was 3 times a day, 30 minutes a day, and where the brain was encouraged and rewarded for producing higher amplitudes of alpha and higher amplitudes of theta. Now, one of the things that we know now about drug and alcohol problems is that the more alcohol, the more drugs a person's using, the brain stopped producing 10 hertz alpha. And we saw on one of the earlier slides that an increase of theta at 12, alpha at 10 hertz, that the brain stops doing. The 10 hertz alpha, the natural alpha, is a natural comforting
so
brainwave frequency. So what happens with drug addicts and alcoholics is the brain stops producing 10 hertz alpha and waits for the drug or the chemical to produce that. The problem happens is the more and more that you're dependent upon drugs or alcohol to produce 10 hertz alpha, you get to a point where quickly where it's more chemical in your body than is going to be helpful with the 10 hertz alpha that it produces, and you wind up in a situation where you're poisoning yourself. So when you talk about alcoholics or drug addicts self-medicating, that's not just a metaphor. It is actually true. They use the drugs and alcohol, it replaces 10 hertz alpha, becomes dependent upon that, and then again, eventually, what happens is the degree of alcohol or drugs begin to kill the body or create behavioral problems as well. So what?
Well, and then the person gets more and more anxious,
Yes.
and then that's why they use more and more.
More and more drugs. It becomes a self-fulfilling prophecy, and it becomes something that is literally tearing the body apart, even though it does momentarily produce a 10 hertz alpha. So Peniston had people in neurofeedback where they would be hooked up to electrodes, and usually it was on either the top here of the brain, which we call PC, or down at what we call O1 or O2, because alpha and theta come from the back of the head and move forward. So again, what was happening, they were hearing sounds of running water, crashing waves, and as they would listen to that and they would get into this kind of sleepy state, when they were asleep, what would happen is the brain would produce the alpha and theta, and they would hear bings and bongs, that would then reward the brain for doing that.
And then while they were in the state, they were instructed to imagine they were presented with the temptation of
Right.
drinking, and they would see themselves saying, no, thank you.
Now, the research project had problems, and they only had 10 men in the control group, 10 men in the treatment group. That's a small n, and you want to have a large number. Well, this was a small number, which created problems to get statistics that were valid. The other thing is all the addicts were polysubstance abusers. Researchers do not like poly. That's poly with one L, not two. So again, to do tight research, you want to have one drug that the person is trying to get off of. Though in reality, that being polysubstance abusers, most alcoholics and drug addicts, if they don't find number one, there's a number two, number three, number four that they will go to. So it was problematic research-wise, but was probably more likely to mimic real live drug and alcohol programs. So we went through the program 3 times a day for the 12 weeks that they were in the program. It was about a 40-day program. At the end of the time, what they found was astounding. This goes with the brain began to reproduce 10 Hertz alpha, that afterwards, a month, 6 months, a year later, 8 out of the 10 that went through the program were still drug and alcohol free. That flipped the numbers upside down. Rather than 20% cure rate, 80% cure rate. Not only that, what happened was that a couple men tried to go back to drinking. They got desperately ill. Now, if you are an alcoholic and you're taking Antabuse, you get very sick. You're not going to die. You're going to think you're going to die, and you want to die. And so they developed what became known as Penniston's disease. The body could not tolerate alcohol. Now, most of us, most people are moderate drinkers. The first time you drink alcohol to any degree, your body typically wants to reject it.
Right.
It's not a pleasant experience. So what happened is the body began to respond as though you were a young person and you drank alcohol, and that was a horrible situation. So what happened was that the body could not tolerate alcohol, and the body did not want the alcohol. So 8 out of the 10 a year, and 5 years later
5 years, that's astounding.
were able to stay off of alcohol. Now, the problem, again, with most drug and alcohol programs is it does not make use of the alpha theta training from neurofeedback. And again, when people get caught in this, they're stuck in a situation where the body is operating paradoxically. It's dependent upon a drug chemical to produce 10 Hertz alpha, but the life of that becomes less and less and less as they get closer and closer and closer to giving themselves alcohol or drug poisoning, and then the behavior to get the drug. The whole life then becomes organized around getting the chemical. So here's the thing that the neurofeedback, the alpha theta training did, was it helped the brain produce 10 Hertz alpha. So the body didn't need the drug or the alcohol to produce that brainwave frequency, and they were able to relax. And again, 1 year, 5 years later, 80% alcohol free.
And then in 2005, we were asked to participate, well, indirectly in a major study. We gave this group some of our neurofeedback equipment with homeless people. But the N this time, the number of subjects was 276, and they did a very similar program with homeless people.
Right, they were in a day hospital, so even more dramatic than Penniston's group, a larger group of 276, but they would come to the day hospital. Afterwards, they were out on the street, either sleeping on the street or in some shelter. So the ability to get drugs was right there, as opposed to being in a hospital where they couldn't. So again, what happens is they had 80%, actually there was a little bit more than 80%, were drug and alcohol free for a period of a year and 5 years later in the Open Door Mission study. And they had trouble getting published because nobody would believe that they went from 20% to 80% cure rate. That's how dramatic the brain state, brain change, and producing the appropriate brainwave frequencies at the desired amplitude can be in dealing with the problem, not only anxiety, depression, but again, addiction to these chemicals where there's just a low cure rate.
Right. And so we keep coming back around to this idea that it's the mental state, the brain state, both that ends up a problem, but it's the elevated states we call alpha elevated, theta elevated. Sounds funny because they're slower brain waves, but
the amplitude is
higher. Elevated. And these are curative. These are curative. So we just want to keep reinforcing that idea with you and encourage you to consider this as an important element in your therapy. So this state right above sleep is called the liminal state. Limin means threshold. It's the deep state where autonomic arousal is lowered, emotional flexibility develops, happiness, optimism, motivation increases, solutions to problems pop into a person's mind. Problems sometimes just dissolve. It's pretty astounding. And pain dissipates, limiting belief shift deep inside occurs, weight loss is easier, anxiety and depression lift, and then people often begin to have much more intuitive ability. So there's a pretty old book now that Elmer Green and his wife Elise wrote. I think it was back in the early 70s. It's still available, called Beyond Biofeedback and Self-Control. And it's kind of academic in the beginning, and the second half is the most interesting because that's where they talk about what they did in the basement of Menninger's in Topeka, Kansas. And they did some fascinating work with people like Swami Rama, who was such an advanced meditator. He could, on two different spots on one hand, raise his temperature and lower his temperature. In another experiment, they have him sitting in a room where there's no blowing air at all, and he mentally can spin a little arrow that's hooked up to a device. He's spinning it with his mental energy. This is not New Age woo-woo stuff. This is really very sound science way back in the 70s. And then Elmer Green worked with Swami Rama, again in another experiment, where he showed Elmer Green how he could go all the way very deep into delta. He was not asleep, but he was producing more delta, and he had amazing awareness. And again, that's a very regenerative thing to be able to do. So the result of practicing this state is that barriers between states dissolve, and Swami Rama talked about developing a state of enlightenment, and then personality seems to integrate. So we develop a lot of our potential. So as we've been talking about, our mind creates problem mental states, and in a moment we're going to demonstrate a process, if you'd like to go along with the exercise, where as you go into theta and probably delta, these waves in the brain will neutralize upsetting events that'll get rid of the charge. But first,
the Walter Reed Army Hospital Medical Center in Washington, D.C. conducted a study for U.S. active duty soldiers who were experiencing PTSD from Afghanistan and Iraq. And what they began to do is to use deep state training, Yoga Nidra, with them to deal with the PTSD as opposed to talking about it. It would begin to help them deal with it through yoga.
The military is always right on the cutting edge because they explore what's out there. One year we did an alpha theta training here in Houston with some neurofeedback systems. And we had military people from all parts of the country show up because they said, we are looking for the silver bullet to help our returning soldiers overcome PTSD. So tranquility can provide really transcendence and transformation where striving, problems, worries, frustrations vanish, and you enter a state that's way beyond ego. There's a whole group, family of neuropeptides that are released as you go down to that state right above sleep. And it tends to mimic marijuana. We're finding that we have receptor sites for all kinds of chemicals that actually we produce, and we mentioned this in another module, some psychedelic chemicals in the brain that are only now beginning to be explored in terms of what their function is. So just like we have a stress system, we have a relaxation system, and the system is being thought of as maybe being able to stimulate our life force, or chi is called in some areas. So whenever you go down into this state, you're right in the range of frequency where your brain produces dream images. And we think of this as your own inner oracle, because it's really fascinating information. I guess this is the time for me to maybe talk about what happened when I went to train with Dale Walters.
Yes.
So Dale Walters was a clinical psychologist who worked with Elmer Green, and they went over to India and studied, how do you call that, fakirs, which were advanced meditators in India. And they could do things like stop their heart for extended periods of time. And
they'd fold themselves up and get themselves buried, and their heart rate would be so slow that they would not suffocate, they wouldn't die, and then after they would unearth them, literally, they'd be buried, and it kind of stretch, and they could then start everything back up, and be awake and aware.
Well, so Dale Walters went around the country doing Alpha Theta workshops, and I was so fortunate to be able to go be with him over a weekend. And this was during a time when we were really having a struggle with our book, Brain Change Therapy. We sent one version of it to W.W. Norton, and they said, we really think you need to rewrite this. And we went, oh. We rewrote it, and we sent in the second version, and then they said, maybe you'd like to take this to somebody else for publication. And we thought, oh dear, this is not good. And so in the meantime, I went to this workshop, and this book had already been advertised around the planet.
And a book cover and everything.
I saw it advertised in London and so forth. So we really wanted to be able to get it out. It just needed some editing. But we needed somebody to help us with that. So I went through this experience with Dale Walters, and we go all the way down to the edge of sleep, and then we'd had this it would stimulate these very interesting images. So what came to me was a mathematical pi, the figure pi, but it was in the sky, that began to spin and became what looked like an Asian pagoda and gently came down to the ground. It was a beautiful mahogany constructed Asian pagoda. And then we say, well, what's pie in the sky? What does that mean to you? Pie in the sky was the book. Because part of me thought, oh, we're not going to be able to get this done. And then my mind said, pie is in the sky is going to turn into this structure that is something important if you just stay with the project. And so I came back and And we got some help, and we got an external outside editor to help us rewrite it. And W.W. Norton said, well, congratulations, this is quite good. So we'd like to take you on this deep dive inquiry into what we call the zero gravity state. If you'd like to participate, and I have outlined on the slide exactly what we're going to do. The first thing, if you're interested, write down a question you would like the other side of your mind to answer. And by the way, you're doing this all the time when you go to sleep and you wake up and you have a dream. If you ask yourself, well, what is the significance of the dream image? So ask yourself, what do you want information about? Could be any of these questions. What's the purpose and meaning of my life? What's a possibility? Or I need direction for a decision. I just want some comment on what I should do about X, Y, and Z. And so I'm going to take you down into a very deep state, just simple relaxation first, and then take you very, very deep. And then I'm going to ask you to go through an imaginary door inside what we call your inner sanctuary. And you're going to go into the inner sanctuary. In your inner sanctuary, you may be able to see what we call a pool of self-compassion, and this is yours. And interact with that. And then you're going to go sit down inside the sanctuary and go as deep as you can. And I'm going to ask you to remain there for about 5 minutes. Normally we do that for a longer period of time, for about 5 minutes or so. And then just be open and present to what comes to you. You may get an image, you may not. You may get sound, you may get some colors. Your mind may just go off somewhere else. It's perfectly okay. Whatever happens, you're in charge of. And of course, you can at any time bring yourself back if you don't want to wait until I bring you back at the end of the exercise. But I think you'll find this really, really interesting. So you're actually going down to an area in your mind. So we're bridging from the conscious to the unconscious. We're going down to where people have called this your higher self or your whole self, so to speak. That is an aspect of you that does not hold your limiting belief system. And it really knows who you are. So what we'd like you to do is put your feet flat on the floor. And then, if you'd like, close your eyes, take a couple of nice deep breaths. And let yourself begin to relax and develop a lovely feeling of comfort. And that might begin at the top of your head, and it might begin to move down. It might begin side to side, or it might begin moving from the feet up. Whatever it is you're the most comfortable doing is certainly fine. Doesn't really matter. Whatever way is comfortable for you. Be sure that you are, if you're in a chair, that your feet are flat on the floor, knowing that as you go very, very deep, you could stay very balanced, and stay sitting in the chair throughout the entire experience. And so take another nice deep breath. Let yourself really begin to enjoy becoming even more comfortable. That's right. And so all the muscles in the body relaxing, kind of moving over the head, facial muscles, over the eyes, back of the mouth. Your mouth can automatically become not too moist, not too dry. but just moist enough to keep you really comfortable. And feeling yourself go down into the throat, into the chest, around your heart, into the space. Focus on the space around your heart for a moment. And feeling that relaxation moving down, now down your arms, down each arm into your hands and your fingers. You might feel a little tingly sensation in your fingers, just as an expression of tension leaving the body. And then bring your attention back to the relaxation in the center of your body, your stomach, going down to your upper legs and over the knees, and back of your knees, down into your calves, your ankles, your feet, and then out your toes. And you might experience a little tingly feeling in your toes, just again, another experience of releasing tension. And as you release that stress and tension, you might imagine yourself in the same way as noticing a lake on a cool morning and watching steam rise because the temperature of the water is different from the air. So you can just imagine the steam of stress rising and getting eliminated into the environment and taken away as your level of comfort continues to just be deeper, deeper, deeper. That's right. Knowing that at any time, if you need to make an adjustment in the way you're breathing, the way you're sitting, certainly that's always something you can do, because this is your experience. And it's the experience that you want to have so that you can make any alteration that you need going forward. So in a moment, I'm going to count down, then from 10 to 0. And I'd like you to follow the numbers, if you will, all the way down to 0. As each number becomes smaller, you can feel yourself relaxing even more. So counting now, 10, 9, going deeper, 8. Just feel yourself releasing even more stress. 7, 6, that's right. 5, going deeper. 4, even deeper. 3, 2, 1, and 0. Feeling so relaxed, so comfortable. And a person can always go deeper. Now in a moment, I'm going to ask you to imagine standing in front of a beautiful mahogany door with the words at the top of the door that say, "Inner Sanctuary." And now see yourself standing there, noticing that door and admiring its quality, really. And then see yourself opening the door gently. And as you step inside your inner sanctuary, begin to notice the details here. Everything is beautiful. The colors are vibrant. The air is completely clean and pure. As you take a few more steps inside your inner sanctuary, this feels so much like home in a way that maybe you've not felt before. And on further inside, as you walk a little bit more, up ahead you see a very beautiful pool. A vibrant colored pool of water. And you walk up to it, perhaps just noticing how the movement of the water is so comforting. And you really understand this to be your pool of self-compassion. So perhaps you decide to sit down next to the pool. Maybe for a moment you'd like to dip your toes in it. And the pool is just that right temperature, so pleasant. Some of you might decide to hop in as you hold on to the side of the pool. And if you do, you just notice how completely relaxing the water is. And you can feel the compassion, the love, the caring, the nurturing for you. And as you stay with this for a few moments, and you begin to take all of that in, your mind might wander. It's perfectly all right. You might get lost in thought and forget where you are, and that's all right. You're perfectly safe. You might decide to get out of the water and over to one of the corners is a large, comfortable chair. So you get up and go over and sit in that chair. It fits you perfectly. It's as if it were made for you. And as you sit in the chair, you find yourself going even deeper, deeper, and deeper, and deeper, all the way to the edge of sleep. And if you fall asleep, that's all right, because we know people hear everything when they're asleep. But if you like to let yourself hover right at the edge, that might be interesting. And I'm going to ask you to hover right here for the next 5 minutes without me speaking to you. And the time begins right now. And now, in a moment, I'd like you to very, very slowly begin to come back. In a moment, I'm going to ask you to get out of the chair you were sitting in the sanctuary. And when you feel that you're comfortable doing that in your mind's eye, let yourself get up, stand up, look around your inner sanctuary, knowing that this is a place that belongs to you and you can come back to it at any time. And then see yourself open the door again. Beautiful mahogany door. Standing now on the other side of the door, and as in a moment I'll count up from 1 to 10, and as you follow the numbers all the way back, very, very slowly, and be very gentle with yourself. You can feel yourself coming back. Counting now 1, 2, 3, very slowly. 4, you might feel your back on the chair. 5, 6, 7, coming back very slowly. 8, 9, and 10. And so when you're ready, you can open your eyes. And take a couple of nice deep breaths. As you become more and more awake, when you're ready, write down if you received any image, if you received any sound, any impression, and put that down on a piece of paper. And as you're still kind of in this dreamy state, ask yourself, what is my association to that if you got something? If you didn't, it's perfectly all right. Something may come to you later. Just take a few moments to do that. Or you may want to make a little note and then come back to it later. And you let yourself really fully come back into the room, really fully wake up. Waking up all the way. And we're going to show you in just a moment, if you had been hooked up to our EEG machine, what would have happened. But we want to tell you that when you create new mental states and thought patterns, you send new signals through your neural pathways, and everything gets altered. Your energy fields, the way you interact with other people, and your mental states influence everybody around you. And hopefully, as you learn to stay in more positive mental states, you're going to have more positive change. And so this is another picture of a whole brain state that we've given you. And after a period of time when you've been in theta, the brain map on the right, very right side is what you see. In this case, red just is a representation of everything harmonizing. But this, if you had been hooked up to our EEG machine, is what happens.
That's what you have are beta, which is typically when you're awake, the highest amplitude, that's the lowest. And you have alpha beneath that. And then you have delta, which is the red. And above is the kind of pinkish purple, which is theta. And here we have theta crossover. So in a theta brain state, theta becomes the highest brainwave amplitude, even though it's only 4 to 7 cycles per second. And there on the right-hand side has the highest part of theta crossover. It's above delta, so they're not asleep. You just see the peak of the theta that's there. And that's when you're in a very, very deep state just above sleep, but not asleep. And that's the intuitive state and the healing state.
That's right. It's a very profound state.
Yes.
It's just a wonderful state to be in. So there you have that. And we're going to mention some simple biofeedback tools, heart math training. You can play around with a thermometer to help you raise your body temperature. Breath training. There's another one called galvanic skin response training. And here are some technologies. The Muse is a little headband you can get. Amazon carries all of this. The Heart Math is computer-oriented games that have to do with learning how to breathe differently. The Bellabee is a new little device that is electromagnetic, so you put a little band on and you can turn on different programs with that, and that's a really useful device. Bellabee.com, you can find that. And then
the temperature training is not your internal temperature, so you're not giving yourself a fever.
right,
It was raising the temperature in your hands,
right,
increasing blood flow, and as you increase the blood flow in your body and increase your skin temperature, relaxation becomes more intense.
that's exactly right. So we wanted to give you these experiences and just talk about some of these other devices that you can have, and want to suggest to you that in a moment or a few moments, depending on when you take Module 6, we are going to be talking about something that we think you'll find very interesting, and that is the state of flow, how to get in the zone, how to teach your clients how to be in the zone, because that really enhances the psychotherapy. So thanks for joining us in this module, and we'll see you
On the other side.